Hello. In our presentation, we will be covering the topic of cardiovascular disease. Cardiovascular diseases, or CVDs, are a group of disorders of the heart and blood vessels. We will be discussing myocardial infarction, coronary artery disease, congestive heart failure, cardiac dysrhythmia, and valvular heart disease.
First, we have myocardial infarction occurs when the flow of blood to the heart is blocked. The cause of the blockage is a buildup of fat and cholesterol. They form a plaque in the arteries that feed the heart. There are about 805,000 cases occurring annually in the United States. Men aged 45 or older, women aged 55 or older, as well as African Americans have the greatest risk of a heart attack.
Exercises can prevent and manage myocardial infarction by increasing the levels of HDL cholesterol and allowing better blood flow. Exercise training following a myocardial infarction can help prevent future complications and increase longevity.
Second, we have coronary artery disease. This means that it decreases blood flow to the heart and eventually leads to chest pain, shortness of breath, and even a heart attack. 18.2 million adults aged 20 or older have coronary artery disease. Obese men and women over the age of 45 have the greatest risk of getting coronary artery disease. It is caused by having a sedentary lifestyle, smoking, and hypertension. There would be a buildup of plaque that blocks the walls of arteries. Regular aerobic exercises can prevent and manage coronary artery disease. It increases cardiovascular functional capacity and decreases myocardial demand. Next, we have congestive heart failure. This means that the ventricles cannot pump in the blood as well, eventually leading to ventricular fibrillation from the electrical system of the heart going off beat. Nearly 5 million Americans have congestive heart failure. African American men who are overweight and people who have had a heart attack are at the greatest risk of getting congestive heart failure. Congestive heart failure is caused by coronary artery disease, heart attack, cardiomyopathy, and conditions that overwork the heart, since they damage the heart's muscles. Exercises prevent and manage congestive heart failure by strengthening the heart as well as improve circulation. This allows the use of oxygen better and an increase in energy level.
The fourth disease is cardiac dysrhythmia. Cardiac dysrhythmia, or arrhythmia, is an abnormal rhythm of the heartbeat. The heart rhythm can either be slower, faster, or irregular. Symptoms include faster slow heartbeat, skipping of beats, or chest pain. Cardiac dysrhythmia can be life-threatening if the heart can't pump enough oxygen-rich blood to the heart or body. There are many risk factors for cardiac dysrhythmia. Atrial fibrillation, a type of cardiac dysrhythmia, affects nearly 2.3 million people in the United States. Age is an important factor, with middle age to older communities being the majority of people affected. Those who are already at risk for heart diseases are at increased risk. Cardiac dysrhythmias can occur if the sinoatrial node, or SA node, develops an abnormal rate or rhythm, the heart's electrical conduction pathway is interrupted, or another part of the heart takes over as the pacemaker. All of these can alter the heartbeat, causing an arrhythmia. The type and amount of exercise that is allowable will vary depending on the cause of dysrhythmia and if there are other forms of heart disease. A doctor should be consulted to determine the acceptable amount of activity that the heart can handle. This can be done through a physical exam or an EKG. The final disease is valvular heart disease. Valvular heart disease is when any valve in the heart has damage or is diseased. The valves of the heart are diseased, leading to the blood being pumped less effectively throughout the body. Heart failure and cardiac arrest are potential risks of this disease. About 2.5% of the US population has valvular heart disease, but it is more common in older adults. About 13% of people born before 1943 have valvular heart disease. Those who have a history of heart disease or heart attack are more at risk. This disease can also be congenital, meaning present at birth. Causes of valvular heart disease are regurgitation, where valve flaps close improperly causing blood to flow the wrong way, stenosis, where the flaps become thick causing reduced blood flow, and artesia, where the valve is not properly formed and tissue blocks blood flow between the chambers. Valvular heart disease, VHD, carries documented risks for active individuals. At the same time, many individuals with intermediate degrees of valve disease can safely exercise and even participate in competitive athletics. Management is key in order to safely exercise with VHD, or valvular heart disease. Thank you for viewing our Pecha Kucha. Thank you, Dr. West.
Thank you, Dr. West. We appreciate you.